Today's video is going to take a look at what you can do with BTEC Health and Social Care. Now, the question really to ask is what is health and social care? Hopefully you're familiar with it and you're probably doing the course, but if you're not, health and social care is a qualification which provides a bit of a background and an insight into working in various care sectors. Care sectors are broken into two halves. Healthcare would relate more to medical care, so maybe hospital based, providing medical treatment or assessments to an individual. Social care is more about working with families, with individuals who are vulnerable, and often is outside of hospital based settings, more care in the community. Health and social care qualifications are designed to give you a little bit of a background so you can transition into these types of career. Now, you may be doing a health and social care qualification already. It could be a level 2, could be a level 3, depending on where you are at the moment. If you're doing a level 2 qualification, that again is going to give you a lot of insight into the healthcare system and help you understand responsibilities, how to protect people, how to look after them. And with that level 2 qualification, you might be able to go straight into a job or a role such as a care assistant or a key worker, a healthcare assistant, or a support worker. If you're doing the level 3 course, which is the sort of A-level sort of style course, then again you're going to build on what you've got in level 2. It may give you a little bit more understanding, a little bit more experience, and again you may be able to go into similar roles and possibly even push a little bit higher within them. Now, with these qualifications, I think with health and social care, GCSE level, BTEC level, it is a course that will help you progress into a healthcare or a social care role. It isn't necessarily going to give you everything you need to get into these jobs, but it's often one of these things that will help transition or move forward into it. So if you're looking at professional jobs like doctors or as you see here, health administrators, care managers, nursing, youth workers, you may need to go down the graduate level, the degree level of this. If you're not thinking about university, you might want to think about social work, medical technicians, healthcare assistants, which are roles you can take on without necessarily having a degree qualification. Now, with this video, obviously, I'm not necessarily going to be able to cover everything. There is a lot of different roles, different careers within healthcare, within social care, and there are endless possibilities of getting into them. And why I've got this little flow diagram here, which comes from Rate My Apprenticeship, and they specialise in looking at apprenticeships, is I thought it was quite good because it kind of indicates that there are so many different ways you can get into these different roles. So it might be that you go down the degree level, you take on a specialism, you get a degree, you go into that employment field. You might be able to take on apprenticeships, you might be able to take on a job and work your way up through that career. So there are lots of different ways of going, and this is quite a confusing thing to think about. And I'd say do the research, take a look at what you want to do, think about what you want to do and how you can get there. Now, you might be in a position where you already know what you want to do. You know where you want to go. You know what career you want to have. And so with that in mind, keep doing that research. Google it, look at it. What degrees do you need? Do you need certain qualifications? Do you need certain types of experience? Try to identify what grades you may be working towards or what you might need to get onto the degree course or the apprenticeship. Try and find any work experience that's relevant to what you want to do. So shadowing opportunities will always be helpful with UCAS applications, with job interviews, and I will talk a little bit about experience and shadowing later. Also, think about where you want to go to university, look for your open days, and again, try and be realistic with your expectations. So, I'm going to go on to do brain surgery. It might be a little bit extreme in some cases if it's not something you're skilled in, you're not very good at the sciences. So think about what you can do and try and be realistic with your decisions. Now, if you do go down the uni route, you may study health and social care at university, and you can combine it with a range of different subjects. So you don't have to do just health and social care on its own as a degree. You might want to combine it with criminology or criminal justice, sociology, early years care, mental health, or rehabilitation. So there's lots of different things you can combine health and social care with if you were to go on to study at university. Or you could study a very specific related course. So if you want to go into a particular field within healthcare. And again, coming back to that point earlier, you know what you want to do, you've made a decision. You could do a degree that studies that specific area of healthcare, and then again gives you more focused skills, more specialist information that will help with that career. Now, the NHS is one of the biggest employers when it comes to health and even some social care. There are loads and loads of different roles, and again, while making this video, it's quite difficult for me to go through every single different health-based career, social-based career, and give you specifics, because there are so many different ways in and there are so many different jobs. So one of the things, this website here, which is healthcareers.nhs.uk, is a really good one to look at. It goes through all the different types of profession, career, role that you could perform in the NHS within healthcare sectors. And it gives you a little bit about the job. It talks about some of the expectations. And I think it's really helpful for working out what you want to do. There's also this career quiz. So again, you can go through this quiz, answer some questions, and it can help narrow down the kind of fields and areas of healthcare you may want to work in. Similarly, this social care website is also very similar in its style. It's more about employment, it's more about jobs, so it's more of a job search. But again, you could look at what's available in your local area. You could look at the types of job within social care, and it does have a description of the job. You can even look at it, it could be helpful for thinking about, like, qualifications, expectations of different social care roles. So again, it could be one that's worth looking at. Now, if you're thinking about a job in health and social care, it isn't just the qualification that's going to be important. Qualifications are always going to be important, but it isn't just having a degree or a BTEC or whatever qualification you have to get into those jobs. There are lots of skills which are really important for you to develop in order to work in these areas. And some of these kind of key skills, which again, I've looked at different jobs and I've looked at different websites and I've kind of compiled some ideas, and this list came from this website listed at the bottom here. These are common skills that are listed frequently as being important. So care and compassion, being able to show care and understanding for someone, being able to support them. And again, working in healthcare or social care, you might have to deal with maybe very deeply personal tasks, like helping someone use the toilet, helping someone wash. And again, you need to handle that with sensitivity. Emotional resilience is really important. Again, making sure that you can help people deal with a stressful situation, deal with a trauma, but also manage that yourself, because again, you're going to absorb some of that emotional stress, emotional issues. And again, how will you manage that? Communication, key skill no matter what the job. So again, being able to express your views clearly, work as a team, share information. Your people skills, again, like communication, you need to be able to work with people, build a rapport. That's really important, particularly in health and social care, when you're working with people who may be going through a bit of a rough time, and you need to be able to build up a rapport very quickly to help with your interactions with them. Time management, teamwork, numeracy, IT, again, very common skills in a lot of jobs and ones that you will build on. Generally, when you're working in your schoolwork, in your college work, degree level, whatever you're doing, you're kind of building on these skills frequently. The last thing I want to mention was about gaining experience. Now, in the current climate with COVID, it's quite difficult to get any work experience. And again, we don't know what's going to happen in the coming months and over the next year. So getting experience may be difficult to do. Even before COVID hit, experience was very difficult depending on what type of healthcare you want to go into. Midwifery, for example, very difficult to get work experience or shadowing. So what I would suggest is looking for any opportunities that hospitals might offer. So again, hospitals used to offer work shadowing or kind of experience days, or talking, offer talks with departments, which could be worth taking part in. It also may be worth looking at jobs or careers or volunteering. That's maybe a slight tangent to what you do, but the skills could be transferred. So working in a care home, or working with children, or doing any kind of voluntary work in a sort of with a particularly vulnerable group, so maybe children or adults. And again, the skills you learn there could be transferred or applied to the role you want to take on. So again, very difficult to get very sort of frequent work experience, and I know it's something that a lot of employers like, but see if you can find anything in a very similar or even maybe a slight tangent to what you're looking at. So, not a fantastic overview, it's very, very brief, very concise, but that's the nature of this. There's so much there, so it's worth looking at, doing your research, talking to your teachers and careers advisors and whatever you need to do to get a little bit of understanding. As always, hope this has helped in some way. Thanks for watching, and again, if you could subscribe to the channel, share it with your friends, that would be really appreciated. And as always, hopefully see you again soon.